Assalamu alaikum. My name is Al-Ula Ala Abdul Hussein. My graduation project is a literature view of white spot lesions, supervised by Dr. Hussein Muhammad Wajih. It has been reported that white spot lesions can be seen as a result of prolonged plaque accumulation. White spot lesions, defined as white opacity, occur as a result of subsurface enamel demineralization that is located on smooth surface of the teeth. This picture would demonstrate a formation of white spot lesions after a prolonged orthodontic treatment. White spot lesions are more often associated with fixed orthodontic treatment and defined as the presence of clinically detectable localized area of enamel demineralization. A significant increase was reported in the prevalence of these lesions around the bracket bases or between the bracket bands and the gingival margin in the cervical area of the middle third of the teeth or under orthodontic wires. Examinations after removal of fixed appliances confirmed that 97% of the subject had one or more lesion, and these lesions increased with age and duration of orthodontic treatment. Demineralization of enamel development due to prolonged plaque accumulation. The formation of white spot lesion would start with plaque accumulation on the tooth surface that would lead to limited clearance of saliva. The limited clearance of saliva would reduce the buffering in plaque of saliva that would lead to acidic or low pH environment. The acidic and low pH environment would increase cardiogenic risk of Streptococcus methanus, which is a bacteria associated with dental caries. That would lead to decalcification in enamel layer. Dental caries is a community disease that is developed due to biological factors that are presented within the saliva and dental plaque and is closely related to the type and frequency of carbohydrate ingestion, as well as the oral hygiene practiced by the individual. The protective factors also presented as a salivary flow rate and buffering capacity and antimicrobial activity, microorganism aggregation and clearance from the oral cavity, immune surveillance, and calcium phosphate binding protein. All these are interacted to inhibit or reverse demineralization of exposed teeth surface. Classification of white spot lesion was made by scientist Gerlich et al. In 1982. This classification would consider both size and intensity of lesion. This small lesion would score 2, which is demonstrated in this picture. The severe lesion would score 3, and if there is cavitation, it would score 4. Lesion which is scored 1, it's the initiation of remineralization process with no lesion clinically observed. Diagnosis of white spot lesions. Over the years, many tools and methods were used to help in detection of white spot lesions, earlier of which were the traditional visual inspection of the lesion or radiograph or the dental probe tactile sensation. In visual observation, reflected light is used to detect changes in color, texture, and translucency of the tooth. However, these traditional methods for early caries diagnosis have been found to be inaccurate and invasive. The new digital methods that would provide more sensitive and accurate results, our transillumination method uses fiber optic light that makes it possible to see smaller superficial white spot lesions by passing intense light beam through the tooth that would result in an optical reflection. The fluorescence and laser fluorescence uses natural fluorescence that occur in enamel of the tooth. The electrical conductivity depends on electrical conductivity monitor, and the ultrasonic method depends on frequency of sound waves applied on the tooth surface and are converted back to electrical impulses to form a detectable texture and form of the tooth surface. The optic coherence tomography uses infrared light to obtain high resulting images, and the laser-induced radiometry or frequency domain laser-induced infrared photothermal that depends on infrared laser light observed the infrared laser light observed of the tooth surface and then obtaining measures depending on the resulting change in the temperature of the tooth surface. This is a picture demonstrating a fluorescence example where it's using the natural fluorescence of the enamel. This teeth suffering from white spot lesion. With the fluorescence method, you can see that the darker lesion that circulated with the blue circle is the white spot lesions, and it's easier for the dentist to observe and to diagnose. Differential diagnosis of white spot lesions. There are many white spot lesions that are doesn't considered as carious lesions. Firstly, before observing the lesion, you need to clear and dry the tooth and then carefully evaluate the lesion by magnification and lighting. You will notice that the carious lesion would appear rough and opaque and porous, while the non-carious lesion would appear smooth and shiny. Differential diagnosis of white spot lesions occur due to hypomineralization of the enamel. Condition causing hypomineralization such as fluorosis, that is demonstrated in the left picture, or traumatic hypomineralization, which is in the middle picture, and molar incisor hypomineralization, which is the right picture. Genetic defects also causing enamel hypoplasia, as well as environmental factors, should be considered during the diagnosis. Management and treatment of white spot lesions. White spot lesions can be remineralized with changing in diet using fluoride varnishes and daily brushing with fluoride toothpaste. Prevention means such as obtaining an oral hygiene, using a mouth rinses, using a fluoridated dentifrice, and using varnishes. Topical fluoride application is the first choice of many clinicians to treat white spot lesions. The initial stage of white spot lesions can be treated successfully with good oral hygiene and topical fluoride application. Inhibit demineralization is one of the fluoride criteria. Always enhance remineralization and inhibits plaque bacteria. There are several ways to obtain topical fluoride, such as fluoride toothpaste that can use twice daily to reduce demineralization, a fluoride varnish, which is high concentrated fluoride, the fluoride mouth rinse that can combine with antibacterial agent, the fluoride gel that would obtain a porous enamel layer that would enhance penetration of fluoride, and the fluoride foam that is derived from milk casein. Treatment of white spot lesion Firstly, we should allow natural remineralization by the saliva. The treatment options are calcium phosphate-based delivery system, polyols, chlorhexidine, laser, probiotic sealants, tooth bleaching, microabrasion, ozone, resin infiltration, and direct composite restoration. Polyols are sweeteners that are weakly metabolized by cryogenic bacteria. There is an evidence that support that the polyols would have a negative feedback on Methanus streptococcus and would help with uh, prevention of dental plaque accumulation. Calcium phosphate based delivery system is delivered from milk casein. It enhances formation of calcium phosphate crystals, so it's prevent the decalcification or demineralization of enamel surface. The chlorhexidine considers as antimicrobial therapy to achieve a shift from unfavorable biofilm to favorable biofilm, so its effect on Streptococcus methanus may be used to complement fluoride therapy. The only negative or drawback of this treatment is it has a tendency to stain teeth. Sealant considered as a good preventive measure for white spot lesion. Glass ionomer cements were suggested as enamel surface sealant due to their properties of better prevention of surface lesions formation. But excessive sealant material may cause retention sites for biofilm that might increase the incidence of carious lesion happening around the sealed area. The tooth bleaching or vital bleaching was recommended to camouflage the white spot lesions that are seen after the fixed appliance of orthodontic treatment. But the micro-hardness of the sound and demineralized enamel would be affected and decreased after the bleaching treatment. So the bleaching treatment would reduce the hardness of the tooth tissue or the teeth tissue. Here's a picture demonstrating a tooth bleaching or vital bleaching technique. On the left, you can see that the teeth has some white lesions due to fixed orthodontic treatment, while on the right, the bleaching treatment helped to camouflage that problem. It has been shown that the use of laser irradiation is effective for caries prevention. Recent studies shows an increased acid resistance from the enamel exposed to laser irradiation. Probiotics, defined as living microorganisms that ensure the health benefit for the host, probiotics may have a positive effect on reducing Streptococcus methanus. It's a bacteria related to dental caries, so this may cause a positive effect on the development of caries. Enamel microabrasion treatment can improve enamel surface texture and remineralization and eliminate superficial staining or defects. This technique includes hydrochloric acid and MOMAS applied to the enamel, which removes approximately 100 micron from the surface layer. The structure of this microabraded enamel surface appear polished because of no interprismatic space, and it's more resistant to bacterial colonization and demineralization. The ozone can reduce the total number of microorganisms by killing the cell walls of the bacteria, viruses, fungi, and also kill the acid-producing bacteria causing decay. However, this type of treatment is only effective in the outer half of the enamel lesion. Resin infiltration is a technique used to improve the appearance of white spot lesions. Resin infiltration technique abstracts the pores that provide diffusion pathway for acidic and dissolving materials to enamel. Thus, it prevents acid penetration into the lesion. Unlike Fischer sealant, this technique creates the diffusion barrier inside the enamel lesion. The clinical instruction of first infiltration is isolating the teeth completely, then adding the icon etch for 2 minutes and washing it, then to air dry the acid etched superficial layer, then adding the icon dry and waiting for 30 seconds. We will notice a change in color. If the change in color isn't observed, then the etching process should be done again. The etching procedure should be done again. After that, we will add the icon infiltrate and we would light cure it, and we will add the icon infiltrate again and light cure it. So it's done twice. The last treatment option is direct composite restoration. It's always associated with a cavity formation, and it's seen in deeper lesions associated with enamel hypoplasia. Lastly is a brief diagram showing the management methods for white spot lesions. Firstly, we would start by giving an motivations instruction, oral hygiene instruction, and allow a natural remineralization, or using a fluoride method, or maybe using the calcium phosphate based delivery system in class 1 and class 2 lesion. In class 2 lesion, when the lesion is obvious, we can use bleaching to camouflage the lesion. In class 3, we will need to use resin infiltration and microabrasion to get rid of the anesthetic appearance of white spot lesion. While in class 4, when there is a cavitation, the only treatment option is a composite filling to fill the empty space. And thank you. And thank you.